Pledge News and Talk. It's Parker and Palmer here. It is 8:45. We want to congratulate the Ottawa County Department of Public Health. They've recently been recognized by the National Association of County and City Health Officials for its ability to plan for and respond to and recover from public health emergencies. Jennifer Sorek is the Public Health Emergency Preparedness Coordinator. Did I get that right, Jennifer?
Yes.
So the county is to be congratulated. That doesn't come as a surprise, but what we want to know this morning, what type of public health emergencies did you have to demonstrate that you're prepared for?
Well, actually, public health preparedness, Project Public Health Ready is a criteria-based planning tool that is utilized from the Center for Disease Control and the National Association of City and County Health Officials. And what it allows us to plan for is any type of emergency. So it can be an epidemiological outbreak where it is a foodborne illness that comes from a restaurant, or it could be something like hepatitis A, which is a communicable disease. It could go back to an influenza outbreak where there wasn't a there wasn't a vaccine for that type, so we could look back at H1N1 when that occurred back in the 2009 time frame. So we really had to demonstrate capabilities to plan from any possible type of emergency, epidemiological, environmental health, disaster behavioral health, things we call non-pharmaceutical interventions, which is when there is a disease that there isn't yet a treatment for. How do we respond for that? So our job was to look at each of the 15 capabilities and then to demonstrate that we had prepared and planned and trained for each of those events.
This is kind of maybe a hard question, but just a little snippet of how can you help the community if something like that would occur?
When we help the community, what we do is we have plans in place to go out and outreach. Our biggest concern in any type of incident is prevention. We want to prevent it from occurring. So we will educate the community. We currently go into with community partners and work on educating how do you prevent illness, how do you keep it out of your facilities. We work with a lot of businesses and discussing like what can they do to keep it out of the facility. And then if it does occur in the facility, then we give them the resources and the tools. For instance, if it's an outbreak at a school, we would give them the tools they would need, as in the educational material, to make sure that they're cleaning properly and stopping the spread of the disease. And then we work with care providers within the community to make sure that the patients are being treated and prevention is occurring.
Is Ottawa County ready for a public health emergency? Yes, they are, because they demonstrated proficiency in 15 areas as we chat with Jennifer Sorek. Jennifer, of those 15 areas that you had to demonstrate proficiency, were there some that Ottawa County was stronger in than others?
I think one of our biggest strengths in Ottawa County is communication and community partnership. We really strive on working with our community partners, and we really strive on educating our community, and then how do we communicate that message when something's going on, our level of response. Every individual within the health department is trained, and they are trained on multiple levers, and they're trained annually. So it really reinforces what we do, and then we take that into the community and work with our partners. We have a great relationship with the hospitals. We have a great relationship with long-term care, emergency management. So all of those pull in together, fire, and that really, when there is an incident, it's a team responding, not just one agency.
So what might be one of the biggest challenges you would have in an incident?
I think our largest challenge, and the one that I would like to see continue to grow, it has grown some, but is our response in a very large outbreak, in the sense like an H1N1 situation. I refer back to that as when you have to open points of dispensing for the community. I would like to get more community partners to become points of dispensing, so that it's not just 4 or 5 locations our community can go to. We can have 20 or 30 locations that people can go to, so we can get the medications or the vaccine or the educational information to the public in a faster fashion, be more efficient. So that would be really the area I feel we'd like to improve the most in.
Ottawa County, one of 500 local health departments across the country that have been distinguished for excellence in preparedness through PPHRP. PPHRP, Jennifer, what's that?
It's Project Public Health Ready.
I see. Are there? Did it take long to make this big report, this big presentation, or was it things that were already done?
A little bit of both. So we definitely had a base. We've always had a plan here at the health department for response. But what this allowed for us to do is to revisit some of those plans. The end-all document ended up being very large, but to look at every element and to reevaluate, is this our best need and how can we do this better? So it really allowed for that. Ottawa did it in about 8 months. It usually takes anywhere between I would say 8 months to 2 years based on your knowledge and based on the criterion what you've had prepared before.
So I think what I hear you saying is that you have just like a great big net stretching all across Ottawa County with all your community partners so that when there is an emergency, we have a whole team of people to help the community.
Yes, yes.
Jennifer, what would be the next step in something like this?
The next step for us, for me, is to continue to reach out to those partners, to get our business organizations involved, to work with more of the community, and to coordinate that with a lot of the preparedness agencies. Hospitals have preparedness individuals, and we have emergency management. But if we all work as a team and pull more partners in, when something happens like a large flood or an outbreak, we are more efficient in response, because a lot of times time can be the enemy in a disaster, and we always want to make it our friend. So the more partners we have, the better off we are preparing.
We're certainly not surprised that Ottawa County Department of Public Health is prepared, because you do a great job.
Thank you.
Thank you for the conversation. Have yourself a great West Michigan day.
All right, you too. Thank you.
Pledge News and Talk. It's Parker and Paul.